Good afternoon. We are thrilled that you have joined us today for this important webinar. My name is Susan Fancher, and I'm joined by my co-host, Stephanie Sargent, to present Bounding Back in 2021, How to Retain Current and Attract New Patients Using SE Healthcare's Patient Experience Platform. Next, please. I see some of our guests today have been clients of ours for many, many years, and others are newer to the platform. A warm welcome to all of you. Today, we're going to discuss key drivers of patient loyalty, using the patient experience for MIPS, sending survey response rates sky high, actions to drive wow factor scores, nailing the data uploads, and much more. Please feel free to ask questions at any time during the presentation by entering them in the chat section at the bottom right on the GoToWebinar dashboard. We will address those at the end. As I mentioned, I'm joined by my amazing colleague, Stephanie Sargent, our resident Chief Clinical and Quality Officer. Stephanie has decades of experience in healthcare and is a certified Lean Six Sigma Black Belt. While her career began at the bedside, she later directed programmatic initiatives as the Patient Safety Program Manager at the Medical University of South Carolina prior to joining SE. I'm Susan Fancher, and I am the Director of Support Success and Services here at SE Healthcare, and I'm pretty positive I've spoken with each of you, not only once, but many times. My goal is to provide our clients with 5-star service throughout our platform, including onboarding and handling of any support issues that may arise. Prior to SE, I was too at the Medical University of South Carolina, where I served as a coordinator and reviewer in the bariatric surgery program. I'd like to note that Stephanie looks the way she does in her picture every day, while I chose a picture from 5 years ago. I'll turn it over to Stephanie to discuss the key drivers of patient loyalty.
Thank you, Susan, and thanks everyone for joining today. I do want to talk to you about key drivers of patient loyalty. So I want you all to know that you can use your patient experience data to really take your practice to the next level, and I'm going to show you how. So a couple of years ago, we took on understanding how practices can improve 2 measures, what we call global measures, and they are likelihood to recommend practice and the provider rating. So taken together, those 2 measures are a proxy for a patient's loyalty to the practice. And a patient's loyalty to your practice really can improve your practice's reputation, attract more patients, and it can keep the ones you have. We know that from surveying patients that the most common way in which they choose doctors and practices is by word of mouth from family and friends. The other way in which practices attract patients is by internet browsing. With the increase in consumerism and patients going to Healthgrades, Google, Yelp, even Angie's List, more than ever consumers are looking at those reviews and what people are actually saying online. So if your practice measures that one question, how did you hear about us? I invite you to go look at that data and look at how patients are coming to your practice. It does vary by specialty, by the way, so I'd be interested to hear from folks on the call what your findings are on that question. Okay, so we took a ton of patient experience data because we've been measuring the patient experience for over a decade, and we did a correlation analysis, and we looked at all the other items on the survey and looked at how highly correlated they were with those 2 global measures that I just said a second ago, likelihood to recommend practice and provider rating. And those items that scored most high in terms of the correlation are in that upper right box, the green box there. So these are all items that patients that score very high, and also alongside that, them scoring high, the loyalty index items scored high as well. So if a practice is looking for key items to look on, I would invite you to look at your practice's performance on those measures in the green box and act on those, because those are what are going to be the biggest bang for your buck for the return on investment. We understand that practices, are tight for resources. So if you're gonna do an initiative, that is where you should focus your attention. I'll give you a quick cautionary tale of a practice that we worked with, and that is a client of ours, and this is years ago. We looked at their data because they had decided that they were going to work on communication with the practice on the phone. And so you can see down in the bottom left-hand corner where that lives, so to speak, in the matrix. And they spent a significant amount of money on a new telephone system, over $10,000. And then we looked at their data before and after to see if those two global measures improved. And unfortunately, they did not. However, improving communication is undoubtedly an important measure. And so all was not lost, but the point is that they were not able to drive those two global measures. So, in terms of a practice improving their reputation in the community, just keep in mind word of mouth is really important. Those green box measures, by the way, are all provider driven. So on SE's survey, the question is, please rate your provider on. And so, how well they explain things, involved you in treatment decisions, explain the follow-up care, et cetera. So they're very provider driven. Not too surprising in one way, because connecting with your providers is something they hold of high value. Okay, let's pivot to MIPS. So if your practice is currently participating in MIPS, and the great majority of practices are, and you're already using our patient experience platform, which I assume everyone on the call is, this is a great opportunity for you to meet one of the improvement activities category measures. So 15% of your MIPS final score is are from improvement activities category. So you're going to need between 1 and 4 improvement activities. The MIPS has 3 activities to choose from that are related to the patient experience, and they center around 2 concepts: the patient engagement and patient access. So let's talk about what these activities are. The activity IDs are on the left, so I, A, B, E, 6. You can go to cpp.cms.gov and you can search on those improvement activities. But IABE6 is collection and follow-up on the patient experience and satisfaction on beneficiary engagement. So that includes developing an improvement plan. So that means choosing an item related to patient engagement on your surveys, and then writing an action plan on how to improve on that, and then documenting it, and then saving that improvement plan, and then you attest to that as an activity when you go to submit your MIPS data. The items that are on the survey that are around patient engagement include things such as discussing treatment options, involving the patient in decisions about their care, explaining things that was in a way that is easy to understand, and explaining the plan for follow-up care. There are other measures, but those are just 4. Here's the good news. Those are all key drivers. Those are all items that are up in that top right green box. So what a great opportunity for your practice. All right, the next one, IAEPA 3. So these are related to access. So collection of the patient experience and satisfaction on access to care, and again, development of an improvement plan. And that could be as simple as outlining steps for how to improve communication with your patients. Further, the item is stratified across patient experience data. So the practice looks at further stratification, including things like perhaps gender, date of birth, or the patient's primary language. Pretty straightforward, and we all understand that access to care is so important in terms of improving clinical outcomes. And then the last one is IABE 13, and this is an improvement activity, again, improving patient access. However, it does involve a targeted patient population, including vulnerable patient populations, economically disadvantaged, racial or ethnic minorities, or looking at underinsured, low income, or the elderly or the homeless. So it invites the practice to consider patient populations such as those to improve patient engagement. Any of these activities, if you're interested in more information, contact us and we will help you understand how to use your data. What we can do for you as well is, aside just the dashboard, we can give you raw data exports, and you can choose to look at the data any way you like. You do want to keep that data in your files for at least 6 years in the event that CMS or the MIPS program does an audit. Again, all you have to do is attest to the activity. And again, if you need advisement, please reach out to us and we can help you on that.
Thank you, Stephanie. That can all be so confusing. Next up, I'd like to discuss increasing your response rates. The more feedback you get, the more opportunities you have to uncover hidden problem areas, reduce patient complaints, and improve overall operations. To do this, clearly, you need your patients to complete the survey. So encourage participation by reminding your provider team to mention the survey during the patient's visit. You can also improve your response rates by having the check-in and check-out staff collect and verify email addresses. Recall, no valid email address equals no feedback. Consult the undeliverable email report that we provide. That should land in your inbox on a weekly basis. Most of the time, the error is obvious. For example, you may see something like susanfancher@gmail.com or name@yahoo.co. Another common one that I see a lot is Comcast, always ends in .net. So those are all easy fixes. Mention that the surveys are confidential and that you won't be using their email addresses for any other purpose. And always remind the patient that you care about their feedback. We've developed an easily printable poster that you can display in your offices, and I'll show you that now on the next slide. We even put some pretty plants around it. So this is included in the handouts on the right-hand side of the webinar. It's called 4 Ways to Improve Your Completion Rate. In that PDF, there's a clickable icon that'll take you to print the survey, either regular paper size or a little bit larger. So again, the link to the posters in the attachments. It'll also be in our follow-up email. So it's that easy, just print and post. Next, I want to discuss actions to drive wow factor score. So I call these our tips and tricks. This is a 10-page document that addresses each of the core questions that are asked in the surveys, and then the 10-page document is also included in the attachments. So when you receive your monthly reports, look for trends. So things, what are we excelling in? Where does our group need improvement? Use these tips to help drive your scores up. I'd like to highlight 4 additional pages for us today. I really like this one, listening carefully to you. We all want to be heard, right? So providers sometimes need to be reminded to do things such as watching their posture and body language and listening for keywords like nervous or scared. And again, just remember to express empathy. Next, please, Stephanie. Okay, let's look here at tip number 3, top right-hand corner, regarding spending enough time with the patient. I want to give you a real-life example. We had a group that received several comments regarding a certain provider that always seemed anxious to get out the door. He would place his hand on the doorknob as the patient was still talking and didn't feel that the visit was over. So that certainly doesn't reflect well on the provider. Again, this is just a great reminder to read every single one of your free text comments, and then you can use these tips to help improve what's lacking there a little bit. Next, please. I included this slide because the amount of time spent waiting to see the provider and the staff keeping the patients informed about delays are classically low scoring responses. I really like tip number 1 regarding the amount of time spent in the waiting room. I know when I go to our local doctor's care, I can check in at home and their system notifies me when it's my turn to come in. This also allows notifications regarding delays. Another suggestion is to be sure to monitor and record your wait times. Drive improvement by setting initiatives to improve. Track this over time, and then you can see how the initiative is going. Next, please. I attached this slide to touch on respecting your privacy. Survey feedback, another real-life example, for a group of ours indicated that while waiting, the patient could actually hear what was going on in the exam room behind them. This cued the practice to install a television in the waiting room. Problem solved. Sometimes the fixes are just incredibly easy. So I suggest always recording the date and change that you've implemented to monitor the progress over time. As you know, one simple change can really drive your numbers up. Next, please. Okay, Stephanie mentioned earlier, we all know patients like to doctor shop. Our 5-star rating reputation tool helps you leverage the power of positive reviews. The link, which is provided under the Providers tab in Patient Experience, displays a code that is then embedded in the website, and it will display the provider's unique rating. We at SE will work with your IT team if your website is managed internally, or we will directly contact your external website development team to get these implemented. Basically a copy paste. It's very easy implementation process. So I do have to click a button, so please reach out to me directly and I'll help you get started. I just enable the feature and you'll be on your way to not only a better looking website, but actual patient reviews. The other thing I wanted to touch on, you see in the example for Dr. Smith there are 1,355 responses. These grow over time. So as long as the provider is active, the ratings will continue to be shown there. So most of our groups do it on right under it, just like it's listed here on the left, right alongside or right under the background of the provider. Next, please. Okay, this is a little squished together, but I know that you have all seen this report. So moments after you upload that patient file, this quickly arrives in your inbox. So I want to go over this. I just made an example for us for today. So it seems like there's a lot of information in this report, but there are so many key things to gather here. I want to just point out a couple of things. So the visit date range, obviously that it's the date of the visits that you just captured. So if you see anything that looks odd there, you may need to adjust your report. The total rows, or how many rows are in your import. Okay, great. The 475 are unique patients. So 475 of those are new. The next, the 486 or 100% of patients uploaded had a valid email address. Anyone that gets that, you deserve a gigantic pat on the back, because that means your staff are really verifying those email addresses. So clearly the higher the better. And the next number and percentage represents the number of your patients that were eligible for a survey. So basically, if you haven't included them in a file, and this is per practice, in the last 90 days, they'll get a survey. Now, if the patient is a repeat, our system will recognize to skip over that appointment. So basically, one survey per practice per 90 days. Down below, underneath the locations and providers, just give this a quick skim. You're going to notice if one of your locations is missing and you need to upload another file. Same goes with providers. Just give it a quick look and you can make sure that everybody's being captured and nobody's being left out. Sometimes there'll be a new provider in the file, and our system will alert you to that and you'll be asked to map. But again, you've all done this, so I know that you know how to do that. Next, please. All right, hooray for just in time. So did you know that you have all these tools at your fingertips? That's why I put this slide in here. In the toolbar on the left, so just look on the left-hand side, just like it looks to you. I did an admin view. You'll see the just-in-time learning library. There are hundreds of videos and documents in there to benefit your practice, from informed consent forms to addressing PPE shortages during COVID. There are plenty of resources that can be found right here. So feel free to explore that. We have them divided up into PDFs, videos, and you can also search by specialty. The other thing I wanted to point out on this slide is that you'll notice the support button that's in the bottom right-hand corner. This is on every single page. It's embedded in every page of PES. So one simple click and you can submit a ticket to us to address any questions or concerns that you might have. I assure you that our support team will reply promptly. Next, please. Thank you. Last but certainly not least, we award our groups with a quarterly accolade based on the highest provider satisfaction rating and the likelihood to recommend your practice. We announced this winner in our monthly client newsletter. And I don't know about you, but I certainly like some bragging rights. So some of you on the call have already received this. So congratulations and shoot to get it again. Next, please. All right, thank you. We have reached the questions portion of the presentation, and we have quite a few questions. Stephanie, you want to go ahead?
Yeah, sure. If you have, feel free to add additional questions in the chat box. I'll run through what we have here. How do I know how my practice is doing on the green box measures? Great question. So there's two ways. In your monthly PDF reports and in the dashboard, there is the option called performance report. And in there, you can filter on all providers. And in your performance report, it's going to show you exactly those green box measures. If you have difficulty finding that, let us know, and we'll get with you and show you exactly where that is in your dashboard and in your PDF report. So all the measures are in the same place in the dashboard in the performance report. All right, next question. How do I prove that I'm participating in an improvement activity for MIPS? So,
Oh, sorry.
yeah, go right ahead, Susan.
Thanks, Stephanie. I'll get that one. In MIPS documentation, you indicate your participation. You'll always have your monthly reports and or you can use the dashboard if you are ever to be audited in the future. So that would show your participation using those tools.
Perfect. All right, next question. Our staff frequently says that patients are difficult and can be demanding. Is there any way we can educate patients to help prevent this? Ah, that's a good one.
That is a great one.
Yeah, and I'm a nurse. I took care of patients, and so I do understand that they can be challenging at times. We actually found that from surveying we did, that patients and families can be a significant contributor to stress. You know, patients oftentimes are frustrated, and they're frustrated that they may have had to wait a long time for the appointment, that maybe they waited in the waiting room too long, or maybe they didn't feel like they were being listened to. I know that with documentation and EMRs, sometimes patients feel like their providers are a little bit distracted and they get frustrated. I invite the answer to this question to be really to turn it and to think about what you can do better to improve communication with a patient. Now, if a patient is escalated, we do have an effective de-escalation technique that we do have in our library in our burnout prevention program. And it's as simple as this. It's 6 steps. Number 1, you need to affirm that that patient is feeling anger or frustration. So it could be as simple as saying, "You look really upset." Number 2, "Tell me all about it." So now you're inviting the patient to ventilate, and let them ventilate. Number 3 is to empathize. Let them know that you care. And so that can be as easy as saying these words: "I'm so sorry that this is happening to you." Number 4 is, "How can we help?" And listen to them. Allow them to problem solve through this. And number 5 is then state what you're willing to do. And number 6 is to thank the patient. And oftentimes, just using that technique de-escalates the patient back down to the extent that you can have a productive conversation. So easy technique. I hope that you'll consider using it. Next question, how often should I upload patient files?
I'll get that one. It's completely up to you. We do have groups that upload on a weekly basis. We do have groups that upload on a monthly basis. My personal opinion is that if I came to see you this week and I get a survey next Monday, that visit is very fresh in my mind and my feedback is going to be familiar, clearly because the visit was less than a week ago. If your resources are limited, you can upload once every other week. But again, I really feel strongly that with the visit just being, had just happened, that you're going to get better feedback the sooner that you get those surveys out. We do get that question a lot. So again, just watch those email addresses to be sure that patients are going to be allowed to get to the survey, and then get your files uploaded as often as you can. But weekly seems to work best for response rate.
Great question. And that really wraps up the questions. So unless there are more, we will wrap up the question and answer session. So I'll be looking for those. Susan, do you want to go ahead and wrap it up?
Sure, absolutely. So all attendees will receive an email follow-up with the link to the PowerPoint and the other references, the other resources that we referred to that are in the handout section on the right-hand side of the webinar. So always, please feel free to reach out to us should you have any additional questions. And I want to thank you all for joining today. Take care, stay safe, and we'll see you next time.
Thank you, everyone. Bye-bye.